So at this time, I'd like to invite Tom McHugh, Executive Vice President of Patient Services and Regional Vice President of Cancer Services, Lakeridge Health, to provide a presentation concerning the master planning and stakeholder engagement in the community. We'll just give the folks a minute to step out and okay, when you're ready, just make sure the green light is lit, and please proceed.
Okay, thank you, Your Worship and Council, for having me here tonight. I'm here from Lakeridge Health to talk about an exciting step we're taking toward our future in Durham. Just to begin, you may know, but Lakeridge Health is one of the largest acute care systems in Ontario. About a year ago, Ajax Pickering joined Lakeridge, and now we are 5 hospital sites and 12 community locations. We are very excited about the opportunity that Ajax Pickering presents for us to be Durham's single health system provider, and the opportunity to work in concert with both municipal and regional councils around that mandate. We have almost 5,000 staff, 780 physicians, and very importantly, 1,500 volunteers who make our hospital run. We have one of the province's top-rated cancer centers. As well, we have specialty programs in nephrology. We have a shoulder center in Ajax Pickering, eye care center in Bowmanville, just to name a few. Ours is among one of the busiest, or among 3 of the busiest EDs in the province, and we serve a diverse and growing community here in Durham. So when we integrated with Ajax Pickering, the Minister of Health made an offer, really a once-in-a-lifetime offer to a hospital system like ours, and that was to take all of the planning for all of our sites in Durham and to look out 30 years in a process that's called master planning, and also to consider whether perhaps there needs to be an extra site of Lakeridge in the future as well. So new hospitals on greenfield sites happen very, very rarely in Ontario, and what we're embarking on is an opportunity to look at the facilities that we have, the future needs of Durham, and to present that plan to the Ministry of Health. So it is an evidence-based planning process, so we certainly are out there, as I'm going to describe to you, listening to people's opinions, but at its base, we use a lot of data around our population, their healthcare needs, and what the future will look like for our communities in Durham. We try to look out at least 25 years, 25 to 30 years is the standard. We look at the care that we need to provide and then the location of the facilities that will provide that care. So we are undertaking a broad community engagement to make sure that we produce the best master plan that we can, and we're looking to be complete in March 2019. Here are a few key principles. As I said, it's a broad-based stakeholder input that we're looking for. It's evidence-based. It's patient and community-focused. So more and more hospitals and healthcare, and I'm sure you are the same in the service you provide for the public, are very interested in what the public say, in their experience, and in their sense of what the priorities are. We'll take a best practice approach. So again, we'll use evidence to suggest, what we should be providing, what is best practice, and importantly, what will emerge as best practice. So we ask our clinicians to sort of crystal ball what their part of our business is going to look like in 5, 10, 25 years. We're very committed to optimizing our existing sites. So Lakeridge Health will always be a multi-site hospital system. There's no way to serve a community like Durham without a number of sites. And so we know that we'll want to optimize the sites that we have. And as I said, there is the potential for a new site as well. I talked a little bit about some of the centers of excellence that we do have around cancer, shoulder, eye care. We think that that is a very useful way to do business as well. So what it does is for each of our sites, they have something special that they do that they contribute to the system. It allows us to focus the volume there and be as efficient as possible and have the highest trained clinicians to look after those patients. So that Center of Excellence model is one that has really worked for us, and it has really worked across Canada as well. There's a context for what we're doing. The LHIN has a clinical services plan, and so that looks in our whole region, including Peterborough and Northumberland, Scarborough, and looks at how services are divided up. That's how Lakeridge became the sponsor for the Cancer Centre, is that is a service that serves the whole region. And there are services in other large hospitals in the Central East LHIN that do things that we don't. A bit about our community engagement approach. So we are in it now. One of the things that we have started is an online survey, web-based survey that's open to all Durham region residents. We'll also have 2 teletown halls. We had some experience with that when we integrated with Ajax Pickering, and that literally thousands of households are robocalled in advance of a town hall, and many, many people join the town hall. There's a panel. We talk through, like we're talking through tonight, what the opportunity is, and then we take calls. And it is amazing. I have participated in them, and it's amazing how many people call in and the interesting questions that they do ask. So that's something we're going to do as well. We're also going to do focus groups in the 5 areas of region: Pickering, Ajax, Whitby, Oshawa, Clarington, and North Durham. We'll invite the business community, advocacy groups, and ethnocultural representatives to a facilitated focus group session to get additional community input. And we expect that those sessions will happen in February and early March. And then there are a number of partners. The region of Durham and its long-term care homes is, for example, one of those partners. And so we'll have a focus group for our close partners in providing care here in Durham to make sure that we understand their perspectives as well. And then at the end of that consultation process, we will invite 20 to 30 people representative of the whole region to explore more deeply some of the themes that we've uncovered and come to the end of our consultation process. What we want to collect are ideas around what works well today that we can build on, what barriers there are to access to Lakeridge Health services, and get feedback about innovative ways that we can do things differently. And you can see that on the right are the engagement questions that we'll use in a very standardized way to get answers for those questions. So with that, I'll end here, and I'm glad to take any questions. I think I'm within my time, Your Worship.
Okay, members of council, questions? Councillor McWhaiting.
In terms of the question around barriers, and since I must phrase things as a question, how will Lakeridge Health be dealing with the overcapacity that's happening in the emergency rooms and how it affects our ambulance services? I know that we do have an offload nurse and there is funding for the province for that. But what I'm hearing is what we see on the main floor in the emergency room is not the full picture of what's actually happening in terms of the backlog for the emergency room. So is there any comment on that or something that you could add?
So I think that this does offer us an opportunity to look out and to look at population growth and where the population will grow, and to size our services and the facilities where we serve them for the future. There are system issues as well in calibrating how much long-term care, how much community service, how much acute hospital. We won't be able to address all of those in our process, and that is one of the major drivers when we get into a flu season and we do get backed up in the hospital. But I think that this will help us for each of the communities that we serve in the region to right-size that care for the future.
And then in terms of those who are having acute mental health issues and are going to the emergency room, how will this process help make things better for those individuals?
So we already have implemented some innovative service that makes it a better experience for patients who come with mental health issues. This year we're also opening 20 beds in Ajax Pickering, which will really take the load off inpatient unit, and that's how things back up into Emerge. And then certainly when we look out to the future, we'll be looking at the incidence of mental health, where to best put our services looking into the future.
Because that's another area with the backlog where it not only affects EMS, but it also affects police, because police are now waiting within Emerge until they can hand off for the discharge of that individual. So it's affecting other services within our community that are no longer able to do what they're supposed to do. And I know that's not fully the responsibility or fault of the hospital. There's funding issues from the province. But I wanted to make sure to ask that. And then the third question that I wanted to ask relates to how women who are having babies are being treated. I know that there has been some reviews since 2011 when I first started raising the issue about the C-section rates, and I see our C-section rates are starting to go down. We used to be one of the highest in the province. Are there any plans to continue or to expand on ways to make birthing experience for women in Lakeridge Health a better experience?
So to go back to your comment on mental health, one of the innovative things that we do is we do work in partnership with the Durham Regional Police with a ride-along program where our nurses are there as well. So we have found that that has had an impact in Emerge as well in our preparedness for patients and being able to divert some. As far as women's and children's health, and particularly obstetrics, that certainly will be part of what we will look at. We, strive to have both attractive facilities for birthing, but also to have the clinical expertise that we need as well. So that certainly, there is really not an aspect of our care that wouldn't come under the microscope as we do this planning.
Okay. And then in terms of the program, we had a program before with the police, and then we were waiting on the contract. Now we have the contract with Lakeridge to do with the ride-along with the mental health nurses. How many mental health nurses has Lakeridge Health provided to the program?
There are 2 right now.
So for the entire municipality of Durham, there are 2?
That's what's funded right now, yes.
And so we're clear, Durham region is the largest landmass municipality, and these individuals are not on like a 24-hour shift, right?
No.
So there's not full coverage when it comes to mental health issues.
Yeah, no, we have a strong partnership with the LHIN who funds this service, and certainly we were anxious to get a start with 2 nurses, and we continue to advocate as partners to make sure that we have the service that we need.
Okay, thank you.
Councillor Bates?
Yes, thank you, Mayor Henry. Mr. McHugh, this is really interesting to me today. I read that Memorial Hospital in Bowmanville is going to have a huge expansion, and it is huge. How are you going to manage the care for the people they normally see? They usually run between, around 15,000 patients through the eye center alone, and I know that because I used to work there. So how are you going to manage that when you're tearing down that area and rebuilding?
So we will, you're familiar with it, we will maintain everything up to and including the eye center, and then tear off that wing that goes to the east and Lambert House. So we will, and it is always a challenge, we will keep the Bowmanville Hospital running throughout the construction period, and then we'll move services from the oldest part of the hospital into the new construction and then repurpose those areas. So that sounds very simple, and the days are long when you're actually doing it. But yeah, that's our plan, is to keep it fully operational during the construction.
Because it also has a very, very busy emergency department.
Right.
And I would hate to see that weight go into another hospital. So that's good. Okay.
Yeah. As we learned from the Port Perry experience with our fire in Port Perry, there's really not any element of our hospitals, even our smaller sites, that we can do without. without affecting patient care. They're all important to us.
Thank you.
Any other questions? Oh, Councillor Kerr.
Perhaps not a question, but a comment, if I might? Or should I just...
It's usually questions, but go ahead.
Well, I just want to extend a heartfelt thank you to you and your staff, and particularly your healthcare staff. I've been an elite athlete my whole life, and unfortunately I've had to avail your services many times in my career, and I've got shoulder surgery coming up in the next couple months, so I really hope you continue the first-rate service at Lakeridge Health.
We will. Thank you very much.
I think there was a question in there someplace. Seeing no others, thank you very much for being
Thanks
here.
very
this
much
evening.
for having me. Good night.
Good night.